Understanding and Practical Implementation of CLAS Standards.
I'm Mary Steady, Administrator of the Office of Student Wellness. I also direct the Safe Schools Healthy Students project in New Hampshire. In September 2013, we were awarded the Safe Schools Healthy Students project at the state level, where we chose 3 LEAs. Part of the requirement of that project is to look at behavioral health disparities in New Hampshire, and also to make sure when we're developing our plans, whether it's the comprehensive written plan or the logic model, that we consider the cultural and linguistic appropriate services.
My name's Amy Paris Grogan, the Behavioral Health, Cultural and Linguistic Competence Coordinator out of the Office of Minority Health and Refugee Affairs in New Hampshire. I became involved with Safe Schools Healthy Students because of the disparities impact statements that SAMHSA issued. In the simplest of terms, a disparity is a difference in access, use, or outcomes of services. And so if there's a difference there, we want to figure out, why that difference exists. So we know nationally that there are differences in the quality of behavioral health services, and we also know that Latina youth are the highest youth to attempt suicide. And when we look at Black students, they're suspended and taken out of school at least three times the rate of their white youth counterparts. And so we want to start looking at what can we do structurally and with our policies to make changes so that we're providing equitable access to services for all of our youth. In New Hampshire, we know that we have disparities in proficiency scores for our third graders, both in reading and in math. And we also know that our white youth graduation rate is 87%, whereas our Black youth is at 76% and our Hispanic youth are at 74%. So we want to take a look at that and figure out how can we make a difference, how can we impact, what can we do within the schools, what can we do to connect those youth. We're really looking to improve behavioral health and social emotional health of students, but we're also trying to integrate behavioral health services into the school system. So it only made sense to use a framework that was already there.
I'm Dr. Trinidad Tellez. I'm Director of the Office of Minority Health and Refugee Affairs at the Department of Health and Human Services. SAMHSA has prioritized use of a framework which is called CLAS Standards, which stands for Culturally and Linguistically Appropriate Services Standards. They were originally produced in 2000 by the Federal Department of Health and Human Services for healthcare, with the recognition that health providing organizations such as hospitals needed concrete guidance on how to try to provide care that is culturally competent and linguistically appropriate and tailored and meeting the needs of their diverse populations all over the country. And they were successful. However, in the decade that ensued, there was a recognition that those recommendations really are useful not just for healthcare providing organizations, but all health, human service, and now even education or social service entities, that really everybody could benefit from understanding what the CLAS standards are. And so SAMHSA prioritized use and implementation of the CLAS standards, and our office was able to provide the staffing and TA to our Department of Education partners, both at the state and local levels, so that people could understand what they were, have coaching, and learn how to operationalize them in their own settings. And so we've been really excited for that partnership and that work, and bringing CLAS standards much farther beyond where it has traditionally resided, which is in healthcare.
CLAS standards, culturally and linguistically appropriate service standards, are divided into 3 themes. So they have a principal standard, which is the overarching goal. The first theme really has to do with systemic changes and policies and procedures. The second theme has to do with communication and language assistance. And the last theme really takes a look at the individual programs. So it's not putting pressure on individuals within a school system or a behavioral health setting, but it's the programs and how do we all work together to improve outcomes.
Some of the other activities that we're doing are training people in multiple projects to be cultural and linguistic competency trainers. Once again, we're partnering around the Office of Minority Health and Refugees Affairs to accomplish that, which will not only benefit the Safe Schools Healthy Students project, Project Aware, but many other projects in our state and other school districts. Brown University is New Hampshire's technical assistance center around equity and excellence. They'll be coming to New Hampshire to be able to put on a state-level conference that not only includes multiple projects we're working with in implementing CLAS standards, but it will allow others in the state to come and hear, what do behavioral disparities look like in New Hampshire? What does CLAS standards mean in the classroom, district, and community level? And it also allowed them to participate in cultural and linguistic competency training.
Governance, leadership, and workforce.
My name is Michelle Halligan Foley, and I work out of the Rochester School District under the Safe School Healthy Students grant. I am the grant director. The first theme that I'm going to talk about focuses on governance, leadership, and workforce. And it really looks at the importance of a system organization responsibility. It focuses on your procedures and your policies so that you're really looking at a fundamental building block for cultural competency. Some of the things that are covered in standards 2 through 4 really focus on ensuring the necessary financial resources so that you can implement CLAS standards. It focuses on ongoing training, CLAS training, as well as cultural competence training. We look at conducting regular assessments of your hiring practices and your retention, advertising your job opportunities in targeted languages. And I think one of the most important things is having conversations with your administration, frank conversations about what the needs of the underrepresented communities are. One of the things that will happen when you implement this with fidelity is that you are in a better position to reach that desired goal of a meeting diverse cultural needs. The changes we are making right now, they're going to affect our student body, and they're also going to affect our community. We have over 4,300 students, and we have over 800 staff. And getting the word out there can be difficult, but we're getting the word out there through our Safe School Healthy Students website, where we are putting resources. We're getting the word out there through our newsletters that we send to over 1,000 people a month, and that includes our employees but also community partners. And we're getting the word out there through some of our presentations that we're doing to our local Rotary and other agencies who've invited us in to present. And on our New Hampshire Knowledge Network, we also have tools available. So lots out there to share for implementation.
Communication and language access.
My name is Michelle Myler from the New Hampshire Department of Education, Bureau of Special Education. I'm the project coordinator for Safe Schools Healthy Students. Theme number 2 in the CLAS standards is communication and language access. It's intended to broaden the understanding of all communication to include Braille, sign language, written and oral interpretation. There are several activities that can be implemented to carry out these standards for communication and language access. One of them is to provide free translation services for all students and families, and to ensure that all of these services and resources are accessible to all staff across the entire district. Phone systems can be set up with multiple languages for families who call and can access the appropriate information in the language that is common to their family. It's also important to remember that communication and language services are important for not only families and students who have limited English proficiency, but also for families who may have a visual or hearing impairment. Some services that can be attained for those families and offered include Braille and other phone systems that can translate to a hearing impaired person. Simple signs and posters in common areas are a great idea. When they see a sign that says welcome in their language, that's the first way that we can really embrace these families and make them feel truly welcome. In Concord, we're using I Speak cards, and they're available at all of the offices where families would come into contact. They have a list of languages visible to them. They can point to what their language is. This helps staff to be able to identify what the language needs are and provide the appropriate match. One of the next big steps for Concord is the creation of a district policy for communication access. This will be vital to the sustainability of class standards and cultural competence and diversity in our district.
Engagement, continuous improvement, and accountability.
My name is Mackenzie Harrington Baycoat. I am the director of our Safe Schools and Healthy Students program in the Laconia School District in New Hampshire. Theme 3 focuses on engagement, continuous improvement, and accountability. It's the last 7 standards of the CLAS standards, so standards 9 through 15, and it's essentially focusing on the big picture. It's looking at policy, accountability, continuous improvement over time via doing assessments and things of that nature to really measure how well your district is either already implementing different services to ensure that you are adhering to the CLAS standards, or whether it is kind of looking at the gaps in the services that you're providing and how you can get to actually meeting the standards. One tool that we've developed in New Hampshire that's been really helpful for us along the way of looking at these smaller things and taking the baby steps, so to say, it's a monthly class tracker that allows us to look at each of the standards and say, what are the activities that we're doing to align with the standard? What are the gaps? And from there, what would be the future strategies that we can implement to roll out that standard if we haven't done so already? And then essentially this tracker helps us to say, have we met that? Have we not met that? Have we exceeded that? It's just really a way to organize yourself and the activities that you're doing to kind of really get a good understanding of whether or not you're addressing them or not as you move forward. Long term for the Laconia School District as well as the other districts in our program, by impacting the systems level, you're really ensuring that over time you're making a change that won't matter regardless of staff transitioning in and out of your school district.
Role of SAMHSA.
SAMHSA's role in this project, Safe Schools, Healthy Students, and allowing us the opportunity to collaborate was critical, because I honestly believe none of it would have happened without SAMHSA's disparity impact statement. And that provided the opportunity for the Department of Ed to reach out to the Office of Minority Health and say, I don't really understand what a disparity is. I don't understand what a disparities impact statement is. How do I answer these questions? What does it mean in New Hampshire? And SAMHSA provided that opportunity for collaboration from the start. So when those questions, when the disparity impact statement questions were addressed, the collaboration had already begun. And we started infusing CLAS standards into the overall comprehensive plan for Safe Schools, Healthy Students in New Hampshire.
Takeaways.
In New Hampshire, we've brought an intentional focus to the needs and concerns of racial, ethnic, and language minorities, because maybe there's not as much of an awareness of that. But some of my sister offices will also include disabilities, LGBTQ issues, and so partnering with the regional health equity entity or Office of Minority Health in your state is a really important place to start. Our goal is to be able to help others. That's how we work best, is in partnership with others and providing TA and coaching and sharing of resources and best practices.
To get there, to reach those standards, has only required minor adjustments for us, which has been a pretty big aha moment. An example would be when we're advertising for our job opportunities and our postings in the district. A really easy way we can get that out to the broader public is to put it through what's called a New Hampshire Equity Listserv, which is essentially an email listserv that is operated by the Office of Minority Health and Refugee Affairs here in New Hampshire. And it basically takes your information that you forward to them and gets it out to the larger community of the state, to nonprofit, and for-profit organizations that are working with minority populations, as just another easy way to get out the information that you're looking for individuals to fill these different positions in your community.
Our biggest takeaways from this program is that CLAS standards is just not about race. It's about how social determinants influence educational attainment. So you're looking at things like education, employment, housing, homelessness, transportation, community resources, and you're really looking at our underserved and underrepresented populations. I guess the second biggest takeaway that I have learned is that your personal cultural attitudes really impact the way you interact with people. so that if you interact in a positive way, we'll make a change in this world, which I think is really important. The third thing is that school districts can do very simple things to make class standards happen within their school district.
In New Hampshire, there's a lot of great people doing a lot of great things. And if we don't start documenting that and sharing it with other school districts and other people, we lose all of that great work when those people leave. And the CLAS standards, using that framework, it really provides a way for continuous quality improvement.
One of the big successes in Concord has been gaining the support of the district level administrators, because this really has to come from top down. We're working on creating policies to support these activities throughout our district, to embed them in what teachers do every day, what administrators do every day, so this is sustainable.
When states are looking to implement CLAS standards, it's important to say, not to say, I'm doing CLAS today. It is a way of being, it's a way of life, it's a way of thinking.
Summary.
The biggest piece of advice that I can give to other states and communities that are starting to implement Safe Schools, Healthy Students is collaboration. That we're all experts in our own individual field, and you don't know what you don't know until you start collaborating. And so having that CLC advisory group and having the opportunity to really collaborate with different offices, the Office of Minority Health, the Bureau of Behavioral Health, and the Department of Education, it allowed all of us to bring our unique assets and work together to really reach every single student. And that's our goal, is that we're improving outcomes for all students in New Hampshire.
By using and implementing the CLAS standards, it has helped us have a frame with which to explain the need for having data. That if you don't have data, you cannot improve what you cannot measure. And if you don't look, you can't know for sure that there are no differences in quality. So again, that's another place where, especially in New Hampshire, it's been very valuable to have the CLAS standards as a framework for continual quality improvement.
CLAS standards are extremely important to the Safe Schools initiative. We are working to overcome and reduce behavioral health disparities so that there's an overall outcome that's positive for students in mental health and in academic achievement.
We are really targeting our underrepresented and our underserved populations. And in a lot of districts, there are, if you look at your data in every district, you have a number of underrepresented and underserved populations that need that support, that need that equality. So it's important to start the conversation, to talk about what they can do so that cultural diversity needs are met. And that way everyone will be successful.
Think of something small. When I go to advertise for a job, am I putting it in papers that's in multiple languages? Are we writing the job description in a way for people who may have low literacy be able to understand it? So I would take one small step, implement that, do the snowball effect, and it will slowly build. And it is a journey. I think that's the biggest thing people need to take away. You don't just do one or two steps and you're culturally competent. It's a lifetime.